Do you know why there has never been a medicine for women for increasing the sexual appetite like Viagra is in men? The reason is that there are many areas of stimulation in women, in contrast to men whose main and sole area is the penis and its various parts. In women, the local area has a clitoris, which has numerous nerve endings, and its extension into the vagina, which is known as G-spot, is again another area of stimulation. There is then a cervical stimulation, which is different from the stimulation when the clitoris is stimulated. Ideal is a blend of all the three: clitoris, the G-spot or the inner extension of clitoris, and the cervical. This produces a heightened response from women. But that's not all. There are then other areas of the body which are erogenous. And prime amongst those are the nipples. Nipples have hundreds of nerve endings and they're very sensitive. So when nipples are stimulated, again, the woman gets a heightened pleasure. Then there are other areas of stimulation which are peculiar to each woman. Different parts of the body, when stimulated, produce different results. And that's why women are a mystery. Some women like their toes to be sucked. Other women like neck area to be kissed. And others like fondling of the breast or indeed stimulation of the other parts of the body. So with so many areas of erogenous action, there's not one area where a drug can act and cause improvement in the sexual activity. That's why it's difficult for us to try and find out a medicine. Nevertheless, I'm quite sure that in the years to come, we will have some medicine or the other for women also. Pink Viagra came in but did not live up to its reputation, and there are others which are in the pipeline. What are the effects of stimulation of an area? There's an increase in the heart rate and respiration. There's an increase in the blood flow to the pelvis and to the genitals, various parts of the genitals, and there's an increased lubrication when the lady is aroused properly. All this makes the sexual activity more enjoyable, more pleasant, and more fun. The vaginal lips, as they are called, labia majora and minora, they also swell up in response to stimulation and are an indicator of normal sexual response. All this means that a lady can end up having orgasm. Now, orgasms are important, not just for the pleasure's sake. There is the contraction of the fallopian tube and the uterus and the other muscles of the pelvis to produce a sensation in the mind, which is extremely pleasurable. But it's very difficult to find out when a woman has true orgasm or she's faking it. There's no way one can find out from that. The orgasm is not just a pleasurable act. It also has its uses. For instance, in pregnancy, the fallopian tube contracts rhythmically, and so does the uterus and other parts of the pelvis. All this aids the movement of the egg towards the sperm and facilitates fertilization and hence pregnancy. Orgasm also improves the health and general condition of the lady. It improves sleep because the woman is more at peace, and it also helps in improving the skin texture through various hormones that are released at the time. Aids in the activity of the heart, and above all, it reduces stress to the levels that they are acceptable. So sexual activity leading up to orgasm is a very good stress buster. So what are the spoilers of all this activity in women? Factors which lead to disinterest in sex in women. And amongst that, most important is excessive stress. Stress of sending the kids to school, stress of managing the family, stress of what food they're going to have in the evening. Even that is a very big stress for Indian women. And that is a spoiler for sexual interest. Then there are relationship problems that can cause this sort of a problem. Poor physical and mental health. History of abortion or sexual abuse during childhood or even in adulthood gives rise to disinterest in women. And excessive spirituality. Being spiritual is okay, but if you're too much into it, especially in the earlier part of your life, then this can change the behavior pattern and also produce a disinterest in sexual activity. Some women feel that pregnancy is not required, they don't require any pregnancy, and therefore sex is not required. This is a misconception which needs to be corrected. If you liked my video, press the like icon. If you have any comments or you would like to talk about certain aspect of sexual health, then put it in the comment section. And oh yes, don't forget to press the subscribe button. Have a great day.